Join us for Baby Boomers in Action. I'm your host, Jim McWhirter. After 8 years of being News 9's About Your Retirement specialist, we are now expanding our Sunday morning segments into a 30-minute fun and informative show here on our network. Don't let the name fool you. Baby Boomers in Action is for all ages. We'll have interesting weekly guests and provide you with great information from tips for living longer to weddings to scuba diving. I'm not sure how all that ties together, but we're going to have a lot of fun every week here on Baby Boomers in Action.
It's time for Baby Boomers in Action. Here's your host, Jim McWhirter.
Don't you just love nature? I sure do. And today on Baby Boomers in Action, we decided that we would branch out a little bit and do our introduction for today's show here in a beautiful garden. One of the things that is going to be very important for us all to remember is that every living creature, whether it's a person, an animal, plants, they're all living creatures, and they all have one thing in common, and that is each one has its own separate special DNA that identifies each of us and them separately. We're going to have two guests with us today that are going to teach us more about the importance of DNA and how it's being used now to help us with people struggling with Alzheimer's and adjusting medications and making sure that our DNA that was given to us separately matches up with the medications that really will work to help us. Welcome to Baby Boomers in Action. Good morning. I'm your host, Jim McWhirter, and I am very excited about our program today. Very important topic that we want to share with our viewers, and we actually shared this topic one Sunday morning on About Your Retirement and got such a response out of it. I have with me today Clay Bullard, who's the president of PGx Medical. Many of you will remember him from that brief segment, but we've got the whole entire show that we're going to focus on today. We actually will have another guest that we will be introducing to you shortly, but for now I want to talk a little bit about Clay, about PGx Medical, and about pharmacogenetics and DNA testing, and that's what our topic is today. And it's a hot topic, it's such an important topic, and I have learned so much about it. But before we go to that, I just feel compelled to share with you about some of Clay's passion and what has driven him, a major part of that drive to get into the medical field, and specifically with DNA testing, because of what happened with his wife years ago when she was in her 30s and being diagnosed with rheumatoid arthritis at such a young age. And one of the things that frustrated him was the fact that so much of the time that they would spend with different doctors was, well, let's try this, and if that doesn't work, we'll try that. So this whole trial and error thing that is very frustrating. I relate to that because my wife 35 years ago had a disease that they said 10 years to live. Well, we've been married over 45 years from now, so they were wrong. But that was very frustrating for us too, because they wanted to continually, well, let's try this, then we'll try that. And part of the time she was sick a lot of the time that I don't think she needed to be. And Clay, you started PGx Medical. Yep. You have gotten into pharmacogenetics, which is DNA testing for laymen like myself. Sure. And tell us about PGx Medical.
So PGx Medical really exists to educate and to assist the medical field and pharmacies to relate to how does medications work for you as the patient, how does the doctor manage meds better, how do you educate everybody in the process. And what PGx Medical does is there was a big gap between education, the doctor wants to test, but then the lab doesn't know that the doctor wants to test. So we do all the behind the scenes work to be able to help the doctor and to be able to the laboratory come together to test the patient, to get beneficial results that allows for better med management, less trial and error, what you talked about. And we just manage that process for them. So we really are the glue between the cracks to be able to help people get better, faster, utilizing the tool of pharmacogenetics. So it's a dynamic field. It's a lot of fun. It's been life-changing for me. It's been life-changing for a lot of patients and families and doctors, and it's just joy every day.
Well, it has, and with respect to what we do at Wellington Parke as a retirement community, assisted living, and specifically our enriched living, which is for people that struggle with Alzheimer's and dementia needs, we have utilized your services and had some dynamic, you use that word dynamic, some dynamic change to help people to really find out the medications that will work the best. And on top of that, the thing that impresses me too is to prevent the adverse reactions that oftentimes go with too many pills at the same time.
Yep. You've got a fabulous physician that comes into your facility at Wellington,
Yes.
Dr. Scott Dellinger. And Dr. Dellinger's been working with pharmacogenetics because of that very fact that he deals with multiple retirement facilities because he comes to it, and efficiencies and medications. But what he became most interested in was, can I treat them better without the patient getting frustrated because they're on this medication which causes this event, which I have to take a pill for that event, and we never dealt with the first one because the original part never worked. So pharmacogenetics just gives him the ability to be able to, this medication may work for Mary, but it doesn't work for Susie, and how do I know that? And the only way he can know that is through pharmacogenetics. So it's a lot of fun to work with him and with your patients in your facility, your clientele that lives there in those communities.
Absolutely, and my mother lives there too, and we just ordered the DNA testing for her to help her with Dr. D, as we call him, and his diagnosis for her. And so, Clay, you mentioned specific doctors, and we've got Dr. Justiz that we're going to introduce later in the show and get some ideas from him. But do all doctors refer to DNA testing?
They don't, and that's actually a great question. There's a big gap. The American Medical Association about 5 years ago started asking physicians, do you know about this pharmacogenetic thing? Which is a little bit odd to me because it's been around for 20 plus years. Ever since we did the Human Genome Project, we're able to manage and monitor DNA. So pharmacogenetics really came into its own whenever oncology and treating cancers and different things. And then it's grown into different areas. But no, not all doctors do. So a lot of what we do is educate. Back to the AMA, the American Medical Association found out that 5 years ago, less than 10% of doctors even knew what it was.
Right.
Now it's in the 30 and 40 percentile, but we only have about 15 to 20% are actually utilizing the product. So no, not all doctors do, but once they become educated on the fact that the majority of the medications that they're prescribing to people in your audience and in your facilities and doctors we work with, there's a warning label on those products that say you should have a pharmacogenetic test to determine whether this medication is going to work for you.
Right.
And when a doctor understands that, then usually they become pretty educated in the process and the value that this tool has to be able to help them manage their patients' lives. So.
Okay. I'm Jim McWhirter, and I want to introduce you to my good friend Rob Weaver. Rob has helped me with my retirement plans, and he can help you too. Rob, tell us some of the things you can do.
Well, we'll help you with retirement and investment planning, with insurance planning, and also with debt reduction.
That's great, and you can contact Rob at 488-7300. Don't forget 488-7300.
I'm just really worried about Mom.
Babe, it'll be all right.
I just don't want her sitting in her room all the time.
Oh, don't worry about that.
Let's party!
Need a break from your kids? Come to Wellington Parke and have some fun. Love our viewer questions, and we appreciate all of you that send them to us. Baby Boomers in Action wants to be sure that we cover as many topics as we can that are important to you. So please email us your viewer questions to the address on the screen.
The city, the school, the neighborhood, the cul-de-sac, the neighbors, the house next door to the neighbors, the RE/MAX agent. The RE/MAX agent who scoped out the school, checked out the cul-de-sac, met the neighbors, greeted the mailman, talked to the kids, found a friend, and discovered the house that she knew the family would love at 107 Meadow. The knowledge to find what's right for you. That's the sign of a RE/MAX agent.
Are you tired of trial and error and a handful of pills for breakfast?
And I'm here to tell you firsthand about residents that we've had at Wellington Parke. Started out taking 17 pills, PGx Medical, their DNA testing with Clay, and eliminated 12 of them, and they're in much better health today than they were yesterday. Clay?
The best way to contact us and learn more about it is via our website, and we'll be able to help you and your doctor in the best way possible for you and for your health care.
Weekly, we have a viewer question that we introduce to our viewer audience, and this week it is about DNA testing. And so we want to share this viewer question with our audience at this time. Jim, my mother suffers from Alzheimer's disease, and I was recently told about some new DNA testing that is being done to help people with adjustment of their medications. This could be what my mother needs. What can you tell us about it? Well, obviously, Clay has been talking about the DNA testing that they do, but this question, Clay, specifically is about her mom and Alzheimer's disease.
Sure.
And what are some of the successes that you can share with us about that? Now we have a little better understanding of what DNA testing is.
Sure. Alzheimer's is a disease that's very difficult.
Yes.
It's multifaceted, it's complex. One of the great examples we have with patients in memory care and with Alzheimer's, even those Alzheimer's that are living in the community still, is a lot of times they can't remember whether the medication's even working for them. So they may have taken the medication and then they feel pain, or they can't remember if they took the pill, and so you get into this question of, is it the medications that are working, or is it my loved one who can't remember if the medications are working? And so what we do is that leads to an early onset of sometimes of depression.
Right.
They go into depression, or we have some other comorbidities that start to show themselves and manifest simply as a result of the Alzheimer's. So Alzheimer's in and of itself is not a specific medication, but it's a complex of the neuro system and how it works. What we do in pharmacogenetics is we test all of those neurons, we test all of the different genomes to make sure that they're active and they're firing and they're working to allow the medication to work. So we just want to know if the medication has the capability to work, and then if it does have the capability to work, what medication can we put you on that allows you to be able to maximize the care and maybe not become depressed or frustrated or have an outburst, which then becomes a behavior, and we hear that all the time, is, they just become where we can't manage them. Well, they're frustrated because the meds aren't working, but maybe the meds are working, but they can't remember if they're working because they didn't take them, or then you have compliance issues. There's just a lot that goes into an Alzheimer's patient, but the baseline is all of us are created with a unique DNA.
Right.
All medications are manufactured to process through the body through the DNA. And what we can now monitor is measuring, does the DNA, is it viable, meaning is there no mutations on it, for this medication, and be able to put them together so that they're able to work.
Right.
And that's the first stepping stone. Why start taking medications? I would never put my father or mother or loved one on a medication that I didn't know that it was going to work for them. And that's what we're capable to do with Alzheimer's and patients like that.
Right. And fortunately, like in our assisted living at Wellington Parke, or any assisted living for that matter, medication management is taken care of for victims of Alzheimer's, dementia, and assisted living. But we know when their meds are given and what's given and what dosage as prescribed by the physician. One of the things that's always frustrated me is, and I'm a certified medication technician, and I pass meds at different times to our residents, and I've shared with you about residents that would have 17 pills to take. And I'm thinking, oh my goodness, how can all of this work together? Does anybody? And that's why I got so excited, as I have learned over the past couple of years, and we've involved your company in Wellington Parke to help us to break all that down. And we have some great success stories of some individuals who I personally feel that we have provided them with a superior quality of life that they would not have received otherwise.
Sure. And a lot of that goes into people that can't get into Wellington Parke or other facilities they might be in. How do I know that where I'm going to be putting mom or dad or aunt or uncle or loved one is?
Right.
How do I know that they're going to manage my mom or dad the best way possible? And for you guys, you do that with the help of Dr. Scott Dellinger. And, you know, Dr. Dellinger even looked at it and he said, you know, I have family members now that are finding out what I'm doing at Wellington Parke, and they're wanting to know how to do this. So he actually opened up an office over there in Moore to help people that aren't in his, you know, assisted living or independent living or nursing home. So it's just a cycle to where what I say is pharmacogenomics broken down is DNA matched to the medication, but even beyond that, it's just common sense. Mm-hmm. Do you want to keep eating food that doesn't taste good? Right. No, you taste it before you eat it, and if you don't like it, you don't try it anymore.
That's right.
That's what we're able to test is, can the medication even work, and will your body like it once they absorb it?
Great. Are your pets being cared for properly? Are they over-medicated? I've got great news for you and your pets. My friend Dr. Brad Roach has a better style of pet care for you and your pets.
Yes, we do, Jim, because if you keep using the same old medicines, you're going to keep getting the same old results. So what we do is we combine Western medicine and the Eastern techniques like acupuncture and essential oils and herbs and other things to get your pet the longest and best life possible.
Contact Dr. Brad at either of his 2 locations today.
Ashland Gardens and the Gardens, the perfect setting for the wedding of your dreams.
Are you tired of trial and error and a handful of pills for breakfast?
And I'm here to tell you firsthand about residents that we've had at Wellington Parke. Started out taking 17 pills, PGx Medical, their DNA testing with Clay, and eliminated 12 of them, and they're in much better health today than they were yesterday. Clay?
The best way to contact us and learn more about it is via our website, and we'll be able to help you and your doctor in the best way possible for you and for your health care.
Okay, that's it. I'm calling Mom. I'm worried about her. I'm just going to call her. Mom?
Hi, honey.
What you doing?
Nothing, just sitting here in the room.
In your room?
You've got to go now. I'm going to get therapized.
She hung up on me and said they're taking her to therapy.
You got a pole, baby. I just love this fishing therapy.
Want to get therapized the Wellington Parkway? Come join us and have some fun. Do you want to enjoy one of the best trips you can ever take? You need to contact Delta Divers. Delta Divers is a one-stop shop. They can train you, they can plan your trips, like to Cozumel, Mexico, where I am right now. And they have all of the equipment that you would ever need to make you a certified scuba diver. That's Delta Divers, 619-DIVE. To help us to answer our viewer question this week, which is about pharmacogenetics, aka for people like me, DNA testing. I need it a little simpler, just like many of our viewers, but this is a very important topic and it is climbing with requests for information from our viewers, and so we want to share as much as we possibly can today. My guests today, Dr. Rafael Justiz and Clay Bullard. Dr. Justiz is board certified in anesthesiology, pain management. He's an associate professor at the University of Oklahoma, and he speaks about pain management, not just in Oklahoma, but all over the world. And so we're going to talk some more about some of my pain. I I need you maybe to help me because my wife says I'm a pain and I don't understand what that means.
I've got a special injection for you.
Okay, here we've got it. Maybe we're going to do it live today. And then I have with me also Clay Bullard, who has been on About Your Retirement with me on Sunday morning earlier this year. And Clay is president of PGx Medical, which is responsible for pharmacogenetics, DNA testing, and so we hope that we're going to be able to provide you a lot of answers to your questions and specifically to help us answer our viewer question. First of all, I want to ask Dr. Justiz, tell us a little bit about your pain management practice.
Well, my pain management practice, currently we have 3 locations in Oklahoma City, Norman, and Purcell, Oklahoma. Our practice is interventional pain medicine, where we do injections on patients, and we also practice medication management, both types.
Okay, so tell me, why would a patient come to you about pain management versus a primary care physician?
Typically, my practice deals more with chronic pain management. So let's say if you hurt your back and you go see your primary care physician, he'll typically have you go physical therapy, treat it acutely for 6 to 8 weeks, and at that point, if it doesn't get better, then he would refer you over to me. And at that point, I would take over and try different modalities, not only physical therapy, but like I said earlier, injection therapy, which works very well for back pain or other types of pain you may have.
Okay, and you mentioned chronic pain management. How many different types of pain management is there?
Well, it's mostly chronic pain management. There is acute pain management in the initial setting. That's the acute phase, anywhere from, like I said earlier, up to 6 to 8 weeks. But after that, the pain sticks around for a lot longer. For example, most patients, 90% of patients, typically get better in 6 to 8 weeks. It's a small subset, 10%, that become chronic pain. So they need a little more advanced treatments for their pain. Not that your primary care physician can't treat your pain at all, but there's only so much you can do with medication management. That's where I come in. I can do interventional procedures that can help deal with your pain.
Okay, and then as far as Clay is concerned, I know you all work together, and with respect to that, Clay, how does Dr. Justiz help you with pharmacogenetics?
Yeah, it's actually the other way around. So I help him in terms of his practice. One of the things he does in his med management and his practice is uses pharmacogenomics. And pharmacogenomic testing, as we've talked about before, is really just marrying a patient's DNA with the medications they're on to make sure that the body can process those medications to get the best outcomes possible. So a practice like Dr. Justiz's, where he's wanting to manage the patient, help them to get better and not just churn them for a long period of time, is to, are you on the right medication that produces the best? So he would use results. I mean, what kind of medications are you using test results for?
So essentially we test for medications like oxycodone, hydrocodone, and what we try to do is we try to optimize that medication. And together with the genetic testing, we know if that medication is going to work for you. We try to get you on the optimal dose, not the highest, but the best dose that's going to work for you.
So do you feel that patients are utilizing pain management therapy and pain management doctors as much as they should be or could be?
No, I really don't think they're utilizing it well enough. Unfortunately, primary care physicians are very limited with what they do. They mostly prescribe pain medications and send patients to physical therapy. In pain management, we do things similar, but we basically we can do a little more for the patient. We could also do the interventional pain component, as well as use pharmacogenetics to manage their medications appropriately.
If you wanted to tell our viewer audience why they need pain management, can you sum it up in a few sentences, a few words? Do you have a slogan?
Definitely. So why do you want to use pain management? Ultimately, you want to take control of your pain with all the tools that we have available today. That means using interventional pain medicine, using medication management with pharmacogenetic testing. Also, I do alternative treatments that are a little more advanced, like spinal cord stimulators. And spinal cord stimulators, there's multiple different types. And essentially, we can use those to ultimately even take patients off pain medication.
I know firsthand what it's like when you begin looking for a retirement community for your family. When I began looking for my mother, I wanted to be sure that I could find the absolute best for her and make sure that all her needs would be met. That's why I designed and built Wellington Parke. We're a gated Christian retirement and continuing care community. Come follow the yellow brick road to enriched living in our exclusive person-centered care neighborhood for those with dementia and Alzheimer's.
At seniorlivingokc.com.
Do you want to enjoy one of the best trips you can ever take? You need to contact Delta Divers. Delta Divers is a one-stop shop. They can train you, they can plan your trips, like to Cozumel, Mexico, where I am right now. And they have all of the equipment that you would ever need to make you a certified scuba diver. That's Delta Divers, 619-DIVE.
Ashland Gardens and the Gardens, the perfect setting for the wedding of your dreams.
Are you tired of trial and error and a handful of pills for breakfast?
And I'm here to tell you firsthand about residents that we've had at Wellington Parke. Started out taking 17 pills, PGx Medical, their DNA testing with Clay, and eliminated 12 of them, and they're in much better health today than they were yesterday. Clay?
The best way to contact us and learn more about it is via our website, and we'll be able to help you and your doctor in the best way possible for you and for your health care.
Love our viewer questions, and we appreciate all of you that send them to us. Baby Boomers in Action wants to be sure that we cover as many topics as we can that are important to you. So please email us your viewer questions to the address on the screen. So beautiful, so interesting to comprehend the fact that we've talked today about DNA, pharmacogenetic testing, and the fact that every plant, animal, and human being, we all have our separate identifying DNA. And that is helping us to be able to help more and more people in different needs of their lives. Specifically, you've heard me talk about at Wellington Parke, some of our residents that have received a better quality of life because of what's discovered in the DNA testing. We're going to continue on with part 2 of our show today next week. So be sure that you come back and join us. And we're probably going to learn more about, am I really a pain, from Dr. Justiz? I'm Jim McWhirter, your host at Baby Boomers in Action.